We've got a clinical case. Let's go. 56-year-old lady presents with progressive abdominal distension, early satiety, and vague lower abdominal discomfort over the past 3 months. She also reports occasional shortness of breath. Oh la 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 la. On examination, there is a shifting dullness suggesting ascites. CA125 is markedly elevated, 125 CA is highly elevated, and ultrasound shows a complex adnexal mass with irregular septations and solid areas. Which of the following the most likely diagnosis? Function ovarian cyst, endometrioma, epithelial ovarian carcinoma, and polycystic ovarian syndrome. So this patient's presentation, progressive abdominal distension, early satiety, vague abdominal pain, ascites, elevated CA125, and a complex adnexal mass is highly likely of epithelial ovarian carcinoma. About epidemiology, most common type of ovarian cars, more than 90% of malignant ovarian tumors are. Age group typically affects postmenopausal women, 50 plus. What else? Pathophysiology, tumor cells spread to the peritoneum producing ascites and pleural effusions, which explain her shortness of breath. CA125, yes, of course, shortness of breath is due to metastasis. CA125, commonly elevating in epithelial ovarian cancers and correlates with disease burden. Imaging, a complex mass with septations and solid components strongly suggests malignancy rather than a benign cyst. Why other options here are incorrect? Okay, so function ovarian cyst. These are benign and related to the menstrual cycle, follicular or corpus luteum cysts. Age, common in premenopausal women, not postmenopausal. What else about function ovarian cyst? Symptoms usually are asymptomatic or cause mild pelvic pain. Okay, so imaging of functional ovarian cyst, simple, twin-walled, thin-walled cyst filled with clear fluid. So that's cyst, no septations or solid areas that we've got in our patient. And CA125, typically normal or only mildly elevated. So 56-year-old woman with ascites and complex mass is not compatible with a functional ovarian cyst. Endometrioma. Endometrioma, so-called chocolate cyst, a benign chocolate cyst formed due to endometriosis. Age, affecting younger reproductive age women. Here we've got 56-year-old lady. Symptoms, cystic pelvic pain, dysmenorrhea, dyspareunia, not progressive distension or ascites. Imaging, homogeneous ground glass echogenic cyst, that's why it's cyst, not complex or solid. And CA125 can be mildly elevated but not as high as in malignancy as we've got here. So the clinical picture and imaging findings do not fit for an endometrioma. And polycystic ovarian syndrome. What is this? It's PCOS, PCOS, hormonal disorder, not a neoplastic process. Typical feature, oligomenorrhea. What else? Infertility, hirsutism, obesity, not ascites or abdominal distension. Imaging, bilaterally enlarged ovaries with multiple small peripheral follicles, stringing of pearls. CA125 is normal. Age usually diagnosed in a young woman, not at 56, due to respect, all due respect, at 56-year-old lady. So thus, PCOS cannot explain these patient's symptoms or imaging findings. Finally, what we've got epithelial ovarian carcinoma in our patients, progressive abdominal distension, early satiety, vague abdominal pain, elevated CA125 ascites, and complex adnexal mass is highly characteristic of epithelial ovarian cancer. Okay? Stay blessed.